Imagine a sudden change in your loved one's thinking and behavior. They seem confused, disoriented, and struggle to focus. This drastic shift could be delirium, a temporary state of mental confusion. Now, picture a gradual decline in memory and thinking skills over time, eventually impacting daily life. This progressive condition might be dementia, a general term for disorders affecting the brain, like Alzheimer's disease. Distinguishing between delirium and dementia is crucial for effective treatment and care. While both conditions share some similarities, their underlying causes, progression, and potential for reversibility differ significantly. Recognizing these differences can empower individuals and families to seek appropriate medical attention and support. In the following sections, we'll delve deeper into the distinct characteristics of delirium and dementia, providing you with the knowledge to navigate these challenging conditions. We'll explore their typical onset, progression, and potential for reversibility. Furthermore, we'll discuss common causes, symptoms, and diagnostic approaches for each condition. Understanding these aspects will equip you with the tools to differentiate between delirium and dementia, enabling timely intervention and optimal care for yourself or your loved ones. One of the most striking differences between delirium and dementia lies in their onset. Delirium typically develops suddenly, often within hours or days. Picture an elderly patient admitted to the hospital for a routine procedure. Suddenly, they become agitated, confused, and unable to recognize family members. This rapid change in mental state, often fluctuating throughout the day, is characteristic of delirium. In contrast, dementia emerges gradually, with symptoms worsening progressively over months or years. Imagine a loved one struggling to recall recent events or conversations. As time passes, they might have difficulty managing finances, following familiar recipes, or remembering appointments. This slow, insidious decline in cognitive function is a hallmark of dementia. The course of these conditions also differs significantly. Delirium tends to fluctuate, with periods of lucidity interspersed with episodes of confusion and disorientation. Imagine the hospitalized patient mentioned earlier experiencing moments of clarity, recognizing their surroundings and engaging in conversations. However, these moments are often fleeting, giving way to renewed confusion and agitation. This fluctuating pattern is a defining feature of delirium. Conversely, dementia follows a progressive decline, with cognitive abilities steadily deteriorating over time. Imagine the loved one with memory problems gradually losing their ability to perform daily tasks independently. They might require increasing assistance with dressing, bathing, and eating. This steady decline in functional capacity is a heartbreaking reality for individuals living with dementia. Perhaps the most crucial difference, particularly for patients and families grappling with these diagnoses, is the potential for reversibility. Delirium, in many cases, is reversible if the underlying cause is promptly identified and addressed. For instance, treating an infection, adjusting medication dosages, or addressing electrolyte imbalances can often resolve delirium. This potential for recovery offers a beacon of hope for individuals and families facing this frightening condition. However, dementia in most cases is irreversible. While medications and lifestyle interventions might temporarily slow its progression or manage symptoms, they cannot cure the underlying brain changes causing the condition. This stark reality underscores the importance of early diagnosis and intervention to maximize quality of life for individuals living with dementia. Delirium, often referred to as an acute confusional state, can arise from various factors, ranging from medical conditions to medications and environmental triggers. Imagine an elderly patient experiencing a urinary tract infection. The infection itself, along with potential dehydration and electrolyte imbalances, can trigger delirium. Similarly, certain medications, particularly those with anticholinergic effects, are known to increase the risk of delirium, especially in older adults. Recognizing the symptoms of delirium is crucial for timely intervention. Common signs include sudden confusion and disorientation, difficulty focusing or paying attention, fluctuating mental status with periods of lucidity and confusion, agitation, restlessness or irritability, sleep disturbances including insomnia or excessive sleepiness, disorganized thinking and incoherent speech, and hallucinations, delusions, or paranoia. Diagnosing delirium involves a comprehensive assessment, considering the individual's medical history, current medications, and recent changes in health or environment. Doctors often use tools like the Confusion Assessment Method, or CAM, to screen for delirium. This tool assesses key features like fluctuating course, inattention, disorganized thinking, and altered level of consciousness. Managing delirium effectively requires a multi-pronged approach, addressing both the underlying cause and the individual's symptoms. Identifying and treating the root cause, such as an infection, medication side effect, or electrolyte imbalance, is paramount. Non-pharmacologic strategies, like ensuring a calm and quiet environment, providing familiar objects and routines, and offering frequent reorientation, can help minimize confusion and agitation. In some cases, medications like antipsychotics might be used short-term to manage severe agitation or psychosis associated with delirium. Dementia, a collective term for disorders impairing cognitive function, stems from various underlying conditions, with Alzheimer's disease being the most prevalent. Imagine a slow and silent accumulation of amyloid plaques and tau tangles in the brain, disrupting communication between brain cells. This progressive damage, characteristic of Alzheimer's, gradually erodes cognitive abilities, leading to dementia. While memory loss is a hallmark symptom of dementia, other cognitive domains can also be affected. Individuals might experience difficulty finding words or following conversations, impaired judgment and decision-making, challenges with spatial reasoning such as getting lost in familiar places, changes in mood and personality including apathy, irritability or anxiety, loss of initiative and motivation, and difficulty learning new information or remembering recent events. Diagnosing dementia involves a thorough evaluation, including a detailed medical history, cognitive and neurological assessments, and brain imaging studies. Doctors assess memory, language, attention, executive function, and visuospatial skills to determine the type and severity of dementia. Brain imaging techniques like MRI and PET scans can help visualize structural and functional changes in the brain, aiding in diagnosis and differential diagnosis. Managing dementia focuses on optimizing quality of life and slowing cognitive decline. Non-pharmacologic strategies play a crucial role, encompassing cognitive stimulation therapy to engage the brain and maintain cognitive function, physical activity to improve cardiovascular health and potentially slow cognitive decline, social engagement to reduce isolation and maintain social connections, and supportive environments that provide structure, routine, and a sense of safety and security. While no cure for dementia currently exists, medications can help manage symptoms and potentially slow its progression. Cholinesterase inhibitors, like donepezil and rivastigmine, can boost levels of acetylcholine, a neurotransmitter involved in learning and memory. Memantine, another medication, regulates glutamate activity, potentially protecting brain cells from damage. Importantly, caring for someone with dementia extends beyond medical management. Caregivers play a vital role in providing emotional support, ensuring safety, and assisting with daily tasks. Support groups and resources for caregivers can offer invaluable guidance, respite, and a sense of community during this challenging journey.